The importance of hydration. Hydration is essential for maintaining good health. Importance of hydration. Staying hydrated is crucial for various bodily functions, including regulating temperature, lubricating joints, delivering nutrients to cells, and supporting organ function. It also plays a role in sleep quality, cognition, and mood. Water as the best hydration source. Water is the best choice for hydration as it is calorie free and essential for bodily functions. Other low calorie beverages like plain coffee or tea, sparkling water, or flavored waters can also contribute to hydration. It's best to limit or avoid sugary sweetened beverages and energy drinks as they can have negative health impacts. Signs of dehydration. It's important to recognize the signs of dehydration, which can include increased thirst, dry mouth, dark urine, fatigue, dizziness, and decreased urine output. Severe dehydration can be life threatening, particularly for older adults and those with certain medical conditions. Factors affecting hydration. Various factors can affect hydration needs, such as physical activity, climate, illness, and certain medications. During hot weather or when engaging in intense physical activity, it's important to increase fluid intake to compensate for increased fluid loss through sweating. Hydration and food. Some fruits and vegetables have high water content and can contribute to overall hydration, including hydrating foods in your diet, such as watermelon, cucumber, and lettuce, can help maintain hydration levels. Maintaining proper hydration is essential for overall health and well being. It's important to listen to your body's thirst cues and drink fluids regularly throughout the day. Water is generally the best source for hydration, but other low calorie beverages can also contribute. If you have specific concerns about hydration or fluid intake, it's advisable to consult your healthcare professional. Are certain drinks better for hydration? Water is the go to beverage for hydration. It is readily available, inexpensive, and helps maintain body's natural water balances. Drinking water throughout the day, especially during physical activity or when feeling unwell, is important for staying hydrated. Sport drinks can be beneficial for hydration during intense exercise or prolonged physical activity. They contain electrolytes like sodium and potassium, which help replenish what is lost through sweat. However, for the average gym goer or those aiming to limit calories, sugar, and sodium, water may be the significant choice. Fruit juice. While fruit juice can contribute to hydration, it's important to be mindful of the sugar content. Some juices can be high in added sugars, which can inhibit hydration. If you choose to drink fruit juice, consider diluting it with water or opting for lower sugar options. Coconut water is often thought as a hydrating beverage due to its natural electrolyte content, primarily potassium. However, it does not contain as much sodium as sports drinks, so it may not be as effective for replenishing electrolytes after intense exercise. Other hydrating beverages. There are various other hydrating beverages available, such as herbal tea, flavored waters, and a fruit and water blend. These can provide some variety and hydration, but it's important to be mindful of added sugars and other ingredients. It's important to note that individual hydration needs can vary based on factors such as activity level, climate, and overall health. Water remains the best choice for hydration in most situations, but other beverages can be included as part of a balanced diet. It's always a good idea to consult with a healthcare professional or a registered dietitian for personalized advice on hydration and beverage choices. The amount of water you should drink daily can vary depending on various factors, including your individual needs, activity level, climate, and overall health. While there may be differing opinions, here are some general guidelines. Harvard Health mentions that most people need about 4 to 6 cups of plain water each day, but the amount can differ based on factors such as other beverages and food intake, health conditions, medications, activity level, and ambient temperature. The National Academies of Science suggest about 2.7 liters for women and 3.7 liters of water for men per day, which would be about 5 to 6 bottles for women and 7 to 8 bottles for men. One source mentions aiming to drink 5 to 7 bottles of water each day, with the size of the water bottle being a factor. For men, it suggests around 7 bottles, 16.9 ounces, or 0.49 liters per day, and for women, about 5 bottles per day. Ultimately, the appropriate amount of water to drink in a day can vary depending on individual circumstances. It's generally recommended to listen to your body's thirst cues and drink enough water to stay adequately hydrated. Consulting with a healthcare professional can provide personalized guidance based on your specific need. Can you overhydrate yourself? Yes, it is possible to drink too much water, which can lead to a condition called water toxicity or water intoxication. Although this is rare, here are some key points. Overhydration occurs when you consume more water than your body can exert. This can disrupt the balance of electrolytes, primarily sodium, in your body. Symptoms: drinking excessive amounts of water can lead to symptoms such as headaches, nausea, vomiting, confusion, seizures, muscle weakness, and in severe cases, it can be life threatening. Factors to consider: factors like psychiatric and neurodevelopmental disorders, certain medical conditions, the use of drugs like MDMA, ecstasy, or Molly, or unusual circumstances can increase the risk of water intoxication. It's important to maintain a balance and listen to your body's thirst cues. Drinking water in moderation and being aware of your individual needs and health conditions is key. If you have certain concerns about your water intake or experience symptoms related to overhydration, it's advisable to seek medical attention. Can you dehydrate yourself? Yes, It is possible to dehydrate yourself. Dehydration occurs when the body loses more fluids than it takes in, leading to an imbalance in the body's water levels. Causes: dehydration can occur due to various reasons, such as inadequate fluid intake, excessive sweating from intense physical activity or hot weather, vomiting, diarrhea, and certain medical conditions like diabetes or kidney disease. Symptoms: mild to moderate dehydration can cause symptoms like increased thirst, dry mouth, dark colored urine, fatigue, dizziness, and dry skin. Severe dehydration can lead to more serious symptoms such as rapid heartbeat, sunken eyes, confusion, fainting, and in extreme cases, it can be life threatening. Prevention: to prevent dehydration, it is important to drink an adequate amount of fluids during the day, especially during periods of increased fluid loss. Water is typically the best choice, but other beverages like sports drinks or electrolyte solutions can be beneficial in cases of prolonged physical activity or excessive sweating. Not drinking enough water can have several risks and negative effects on your health. Here are some potential consequences: decreased physical performance. Insufficient hydration can lead to decreased strength, endurance, and power, which can impact your overall physical performance and exercise capability. Increased risk of chronic diseases. Chronic dehydration, especially when combined with weight gain, particularly in the abdominal region, may increase the risk of various chronic diseases, including diabetes and heart disease. Impaired cognitive function. Dehydration can affect cognitive function, leading to symptoms such as difficulty concentrating, feeling foggy, and decreased mental clarity. Digestive issues. Insufficient water intake can contribute to constipation and sluggish bowel function. Water helps soften stools and promotes regular bowel movements. So, not drinking enough water may lead to abdominal pain, cramps, and constipation. Increased risk of urinary tract infections. Chronic dehydration can impact the risk of developing urinary tract infections. Staying adequately hydrated helps maintain urinary tract health and flushes out bacteria that can cause infection. Muscle cramps and fatigue. Dehydration can lead to muscle cramps, fatigue, and a decrease in overall muscle mass. Proper hydration is essential for optimal muscle function and recovery. Headaches and migraines. Insignificant water intake can contribute to headaches and migraines. Dehydration affects blood level and can trigger headaches in some individuals. Impaired thermoregulation. Water plays a crucial role in regulating body temperature. Not drinking enough water can impair your body's ability to cool down, leading to heat related issues such as heat cramps, dizziness, and lightheadedness. It's important to note that these risks can vary depending on individual factors and the severity of dehydration. To maintain good health, it's recommended to drink an adequate amount of water daily and pay attention to your body's hydrational needs. Remember, if you experience persistent or severe symptoms related to dehydration, it's advisable to consult with a healthcare provider for proper evaluation and guidance. To handle hydration while being outside in the sun, consider the following tips. Drink water regularly. Stay hydrated by drinking water throughout the day, even if you don't feel thirsty. Dehydration can occur quickly in hot weather, so it's important to replenish fluids regularly. Monitor urine color. Use the color of your urine as a guide to determine your hydration level. Clear to pale yellow urine indicates good hydration, while dark yellow urine may indicate dehydration. Aim for a lighter color by drinking enough water. Prehydrate. If you know you'll be spending an extended period outside in the sun, consider prehydrating by increasing your fluid intake before going out. This can help ensure that your body is adequately hydrated before exposure to the sun and heat. Choose hydrating beverages. Water is the best choice for hydration, but you can also opt for electrolyte enhanced drinks or diluted 100% fruit juice to replenish electrolytes lost through sweating. Avoid beverages with caffeine or alcohol as they can contribute to dehydration. Take breaks in the shade. Give yourself regular breaks from direct sunlight to prevent excessive heat exposure. Seek shade or create your own shade using umbrellas, hats, or other sun protective accessories. Monitor your body. Pay attention to signs of dehydration or heat related illnesses, such as dizziness, fatigue, headache, or increased heart rate. If you experience these symptoms, seek shade, drink water, and apply cooling compresses to help cool down. If symptoms persist or worsen, seek medical attention. Remember, staying hydrated is crucial for maintaining your well being and preventing heat related illnesses. By drinking water regularly, monitoring your urine color, and taking appropriate precautions, you can help ensure that you stay hydrated while enjoying time outside in the sun. Staying hydrated is important even during the winter months. Here are some tips to handle hydration while being outside in the winter. Drink water regularly. Just like in any other season, it's important to maintain regular fluid intake, even though you might not feel as thirsty in cooler temperatures. Dehydration can still occur. Drink water throughout the day to stay properly hydrated. Warm beverages. Enjoying warm beverages can be a comfortable way to stay hydrated during the winter. Sip on herbal teas, hot water with lemon, or warm fruit infused water. You can also opt for warm soups or broths, which not only hydrates but also provides nourishment. Limit alcohol and caffeine. While it may be tempting to indulge in hot alcohol or caffeinated beverages during the winter, be mindful of their dehydrating effects. Both alcohol and caffeine can increase urine production, leading to fluid loss. If you consume them, do so in moderation and balance them with adequate water intake. Protect from frostbite. Frostbite can occur in extremely cold temperatures, so it's important to protect exposed skin from freezing. Use appropriate winter clothing, including gloves, hats, scarves, and face masks to cover vulnerable areas. By preventing frostbite, you can help maintain overall health and hydration. Monitor hydration signs. Even though you may not feel as thirsty in the winter, pay attention to signs of dehydration. Dry mouth, dark urine, fatigue, and dizziness can indicate inadequate hydration. If you experience these symptoms, increase your water intake. Eat hydrating foods. Incorporate hydrating foods into your winter diet. Fruits and vegetables with high water content, such as citrus fruits, watermelon, cucumbers, and celery, can contribute to your overall hydration. Can dehydration cause medical problems? Yes, hydration can cause serious health issues. Here are some potential complications. Heat injury. In hot weather, not drinking enough fluids while exercising vigorously and perspiring heavily can lead to heat related injuries, ranging from mild heat cramps to heat exhaustion or potentially life threatening heat stroke. Urinary and kidney problems. Prolonged or repeated bouts of dehydration can increase the risk of urinary tract infections, kidney stones, and even kidney failure. Impaired cognitive function. Dehydration can affect cognitive function, leading to difficulty concentrating, feeling foggy, and decreased mental clarity. Increased risk of chronic diseases. Chronic dehydration, especially when combined with weight gain, may increase the risk of various chronic illnesses, including diabetes and heart disease. Muscle cramps and fatigue. Dehydration can lead to muscle cramps, fatigue, and a decrease in overall muscle mass. Proper hydration is essential for optimal muscle function and recovery. Headaches and migraines. Insignificant water intake can contribute to headaches and migraines. Dehydration affects blood volume and can trigger headaches in some individuals. Impaired thermoregulation. Water plays a crucial role in regulating body temperature. Not drinking enough water can impair your body's ability to cool down, leading to heat related issues such as heat cramps, dizziness, and lightheadedness. Severe complications. Severe dehydration can lead to low blood volume shock, swelling of the brain, and in extreme cases, it can be life threatening. It's important to note that the severity of these complications can vary depending on individual factors and the extent of dehydration. If you experience persistent or severe symptoms related to dehydration, it's advisable to seek medical attention for proper evaluation and care. Remember, staying adequately hydrated is crucial for maintaining overall health and well being. By drinking enough fluids and paying attention to your body's hydration needs, you can help prevent the risks associated with dehydration. Are electrolytes important for hydration? Yes, electrolytes are important for hydration. Electrolytes are minerals that are involved in many essential processes in the body. They help regulate fluid balance, nerve function, and contractions. During periods of dehydration, such as intense exercise, illness with vomiting or diarrhea, or exposure to hot weather, the body can lose electrolytes along with fluids. Replenishing these electrolytes is crucial for restoring proper hydration and maintaining optimal bodily functions. Sodium. Sodium is an essential electrolyte that helps regulate fluid balance and maintains proper nerve and muscle function. Potassium. Potassium is important for maintaining proper heart and muscle function, as well as fluid balance. Chloride. Chloride works together with sodium to maintain fluid balance and help with nerve function. Calcium. Calcium is involved in nerve contractions, nerve function, and bone health. Magnesium. Magnesium plays a role in muscle and nerve function, as well as maintaining a healthy heart rhythm. Replenishing electrolytes can be done through various means, including oral rehydration solutions, sports drinks, and foods that contain electrolytes. It's important to note that while electrolyte beverages can be beneficial for rehydration, they may not be significant for treating severe dehydration, and medical advice should be sought in such cases. Explanation of the role of electrolytes. Fluid balance. Electrolytes, primarily sodium and chloride, help regulate fluid balance through a process called osmosis. They help maintain the right amount of water inside and outside cells, ensuring proper hydration. Nerve function. Electrolytes like sodium, potassium, and calcium are involved in generating and conducting electrical impulses in nerve cells. They play a vital role in transmitting signals between nerve cells and throughout the body. Muscle contraction. Electrolytes such as calcium, magnesium, and potassium are necessary for muscle contraction. Calcium allows muscle fibers to slide together and contract, while magnesium helps the muscle relax after contraction. pH balance. Electrolytes like bicarbonate help maintain the body's acid base balance, pH. They play a role in regulating the acidity or alkalinity of body fluids, which is important for proper cellular function. Nutrient absorption. Electrolytes, primarily sodium, help cells absorb nutrients. They facilitate the transport of nutrients across cell membranes, ensuring proper nutrient uptake by the body. Maintaining the right balance of electrolytes is crucial for overall health and well being. Imbalance in electrolyte levels can lead to various health issues. For example, dehydration can result from an imbalance of electrolytes, leading to symptoms like muscle cramps, weakness, confusion, and even seizures. It's important to note that electrolytes can be obtained through a balanced diet that includes foods rich in electrolytes, such as fruits, vegetables, and certain beverages. In some cases, electrolyte supplementation may be necessary, especially during periods of intense physical activity, illness, or excessive fluid loss. Electrolytes are essential minerals that carry an electrical charge and play a crucial role in maintaining fluid balance and other bodily functions. Here are some ways to get electrolytes. Foods. Many foods are rich in electrolytes like potassium, sodium, calcium, and magnesium. Fruits. Avocados, bananas, oranges, and watermelon are good sources of electrolytes. Vegetables. Spinach, leafy greens, and other vegetables contain electrolytes. Dairy, milk, and yogurt are sources of electrolytes like calcium and potassium. Poultry and lean meats. These foods provide electrolytes like potassium and sodium. Nuts and seeds. These are also good sources of electrolytes. These foods can help contribute to hydration. They should not replace the consumption of water or other fluids. Hydrating drinks. Certain beverages can help replenish electrolytes. 100% fruit juice. Opt for juices without added sugar, such as orange juice or lemonade. Sports drinks can provide electrolytes, but water, while tap or filtered water contains some electrolytes, it's usually not enough to meet daily needs. Electrolytes from foods and drinks are necessary. It's important to note that individual electrolyte needs may vary based on factors like age, activity level, and overall health. If you have concerns about your electrolyte levels, it's best to consult with a doctor for personal advice. Remember to maintain a balanced diet and stay hydrated to support your electrolyte levels and overall well being. Hydrating soups. Broth based soups. Broth based soups, such as chicken noodle soup, beef stew, and vegetable soup, can be hydrating options. They contain fluids and electrolytes like sodium and potassium, which are essential for proper hydration. Dehydrated soups. Dehydrated soups can be a convenient option for outdoor activities or emergencies. They can be rehydrated with boiling water and provide a lightweight and portable source of hydration and nutrition. Examples include hydrated minestrone soup and instant dry soup mixes. Gazpacho. Gazpacho is a cold, uncooked soup made from hydrating fruits and vegetables like tomatoes, cucumbers, and peppers. It can be refreshing and hydrating choice, especially in hot weather. Cucumber soup. Chilled cucumber soup can be a refreshing and hydrating option. Blending cucumbers with low fat yogurt, mint, and ice cubes can create a hydrating soup that is delicious any time of year. While soups can contribute to hydration, they should not replace the consumption of water or other fluids. Individual electrolyte needs may vary. Can certain conditions cause electrolyte deficiencies? Yes, certain health conditions can cause electrolyte deficiencies or imbalances. Kidney disorders. Kidney diseases or damage can affect the body's ability to regulate electrolyte levels, leading to imbalances. Conditions such as chronic kidney disease, kidney failure, and certain inherited kidney disorders can disrupt the balance of electrolytes. Gastrointestinal disorders. Conditions that cause severe vomiting, diarrhea, or malabsorption in the gastrointestinal tract can lead to electrolyte imbalances. These include gastrointestinal infections, inflammatory bowel disease, celiac disease, and certain surgeries that affect nutrient absorption. Endocrine disorders. Hormonal imbalances, such as those seen in adrenal inefficiency, Addison's disease, can affect electrolyte levels. These conditions can disrupt the balance of sodium, potassium, and other electrolytes. Heart conditions. Some heart conditions, such as congestive heart failure, can impact electrolyte balance. These conditions may affect the body's fluid balance and the ability to regulate electrolytes properly. Diabetes. Diabetes, particularly when poorly controlled, can lead to electrolyte imbalances. High blood sugar levels and associated fluid and electrolyte losses through frequent urination can contribute to imbalances. Certain medications. Certain medications, such as diuretics, laxatives, and some chemotherapy drugs, can affect electrolyte balances. These medications may increase fluid loss or interfere with the body's ability to maintain electrolyte balances. It's important to note that electrolyte imbalances can have various causes, and the specific underlying condition or situation should be addressed for proper treatment. Treatment may include managing the underlying condition, adjusting medications, or providing electrolyte supplementation as needed. Are certain age groups more prone to deficiencies? Infants and young children have a higher risk due to their smaller body size and higher fluid requirements related to their body weight. Older adults may be more prone to dehydration and electrolyte imbalances due to factors such as age related changes in kidney function, the use of multiple medications that can affect electrolyte levels, and a higher risk of certain health conditions like kidney disease and heart failure. Deficiencies in certain electrolytes can cause health issues. Sodium. A deficiency in sodium can lead to hyponatremia, which is characterized by symptoms such as nausea, headache, confusion, seizures, and in severe cases, coma. It can occur due to excessive sweating, prolonged vomiting, or diarrhea, certain medications, or medical conditions affecting kidney function. Potassium. Low potassium levels, known as hypokalemia, can cause muscle weakness, fatigue, irregular heartbeat, constipation, and in severe cases, paralysis. It can be caused by excessive sweating, certain medications, kidney problems, or inadequate dietary intake. Calcium. Calcium deficiency can lead to weakened bones, muscle cramps, numbness or tingling in the fingers and toes, and an increased risk of fractures. In severe cases, it can contribute to conditions like hypoglycemia and osteomalacia. Magnesium. Magnesium deficiency can result in muscle weakness, tremors, fatigue, irregular heartbeat, and mood changes. It can be caused by inadequate diet intake, certain medications, gastrointestinal disorders, or excessive alcohol consumption. Chloride. Chloride deficiency is rare, but it can occur in cases of prolonged vomiting or diarrhea, excessive sweating, or certain medical conditions. Symptoms may include muscle cramps, weakness, and metabolic alcoholism. It's important to note that electrolyte deficiencies can have various causes, and the symptoms can vary depending on the specific electrolyte involved and the severity of the deficiency. If you suspect an electrolyte deficiency, it's best to consult a healthcare professional for proper diagnosis and treatment. How quickly can deficiencies impact one's health? The impact of deficiencies on one's health can vary depending on the specific nutrient and the severity and duration of the deficiency. In some cases, the effects may be noticeable relatively quickly, while in others, it may develop gradually over time. Short term effects. Some deficiencies can cause noticeable symptoms in the short term. For example, a deficiency in potassium can lead to muscle weakness, cramps, constipation, and abnormal heart rate. A deficiency in vitamin B12 can result in fatigue, numbness, trouble with balance, and cognitive impairment. Long term effects. Prolonged deficiencies can have more significant health consequences. For instance, calcium deficiency can increase the risk of osteoporosis later in life. Vitamin A deficiency can impact vision, immune function, and skin health. Iron deficiency can lead to anemia, causing fatigue, weakness, and shortness of breath. Hidden hunger. Micronutrient deficiencies, also known as hidden hunger, may not always have immediate visible effects, but can still have long term impacts. For example, deficiencies in iron, zinc, and vitamin A are prevalent globally and can lead to anemia, impaired immune function, and other health issues. It's important to note that the timeline for the development and manifestation of deficiencies can vary depending on individual factors, such as overall health, diet, and lifestyle. Regular monitoring of nutrition levels, maintaining a balanced diet, and seeking medical advice when experiencing symptoms are essential for addressing and preventing deficiencies. Can deficiencies affect mental health? Yes, deficiencies in certain nutrients can affect mental health. The search results indicate that nutrient deficiencies can impact brain function, the production of hormones and neurotransmitters, and overall mental health well being. Neurotransmitter imbalances. Imbalances in neurotransmitters such as dopamine, serotonin, or noradrenaline and GABA have been associated with mental health problems. Specific nutrients. Several nutrients have been linked to mental health. For example, deficiencies in omega 3 fatty acids, B vitamin minerals, and amino acids and are precursors to neurotransmitters, can contribute to mental health issues. Sleep and mental health. Poor sleep, which is a mental health condition that often co occurs with depression and anxiety, can be influenced by nutrition deficiencies. Overall well being. Nutritional deficiencies are considered an overlooked biological element in mental well being. A healthy diet and proper nutrition are important for both mental and physical health. It's important to note that while nutritional deficiencies can contribute to mental health issues, they are not the sole cause. Mental health conditions are complex and have multiple factors, including genetic, environmental, and psychological factors. Nutritional interventions and addressing nutrient deficiencies can be part of a comprehensive approach to mental health care, but it's essential to consult with a qualified healthcare provider for proper diagnosis and treatment. How do these deficiencies impact mental well being? Neurotransmitter imbalances. Neurotransmitters play a crucial role in regulating mood, emotions, and overall mental health well being. Brain function and structure. Poor nutrition can affect brain function and structure, impacting cognitive abilities, memory, and overall mental performance. Nutrient deficiencies can impair the production of hormones and neurotransmitters, which are essential for proper brain function. Depression and anxiety. Deficiencies in certain nutrients, such as B vitamins, omega 3 fatty acids, vitamin D, magnesium, zinc, and iron, have been linked to an increased risk of depression and anxiety. Adequate levels of these nutrients are important for maintaining optimal mental health. Sleep disorders. Nutritional deficiencies can also impact sleep quality and duration, which in turn can affect mental well being. For example, deficiencies in omega 3 fatty acids and vitamin E have been associated with sleep disruptions. Overall well being. A balanced diet and proper nutrients are important for overall well being, including mental health. Nutritional deficiencies can contribute to feelings of fatigue, low energy, and poor mood. It's important to note that while nutrient deficiencies can impact mental well being, they are not the sole cause of mental health conditions. While staying hydrated is important, not all drinks are equally effective at hydrating the body. There are some drinks that are not considered good for hydration. Energy drinks. Energy drinks are not hydrating and may contain caffeine, artificial sugars, and chemicals that can have a diuretic effect and increase fluid loss. Fruit smoothies. While fruit smoothies can be a healthy choice, they can also be high in sugar and have a thick consistency that may contribute to dehydration. It's important to be mindful of the sugar content and consider adding extra ice to increase the hydration factor. Soft drinks and fizzy drinks. Most soft drinks are high in sugar and can contribute to tooth decay and weight gain. Some fizzy drinks may also contain caffeine, which has a high diuretic effect and increased fluid loss. Alcohol. Alcohol acts as a diuretic, causing increased urine production and potentially leading to dehydration. The extent of dehydration depends on the total volume of the alcohol beverage consumed. Strong alcohol drinks can dehydrate, while dilute alcohol drinks may not have the same dehydrating effect. Sugary fruit drinks. Fruit juices should be high in sugar and may not provide the same level of hydration as whole fruits. It's recommended to choose 100% fruit options with pulp to retain some fiber and to enjoy it in moderation. It's important to note that water is generally the best choice for hydration. However, if you're looking for alternatives to plain water, there are other options available that can help keep you hydrated, such as milk, herbal tea, coconut water, and electrolyte enhanced drinks in moderation. The optimal time to stop consuming caffeine before bed can vary depending on individual sensitivity and sleep patterns. However, here are some general guidelines: 4 to 6 hours before bed. On average, most people should stop drinking caffeine 4 to 6 hours before bed to minimize its potential impact on sleep quality. Avoid caffeine after 2 p.m. Research suggests avoiding caffeine consumption from around 2 p.m. or at least 7 hours before bed to prevent negative effects on sleep. Individual variations. Sensitivity to caffeine can vary from person to person, so it may require some trial and error to determine the ideal cutoff time for caffeine intake. Some individuals may need to stop earlier in the day or avoid caffeine altogether if they particularly sensitive to its stimulating effects. It's important to note that if you regularly consume caffeine and decide to stop or reduce your intake, you may experience withdrawal symptoms such as headaches, tiredness, sleepiness, mood changes, trouble concentrating, and crankiness. These symptoms can last anywhere from 2 to 9 days. Ultimately, it's best to listen to your body and pay attention to how caffeine affects your sleep. If you find that caffeine consumed late in the day disrupts your sleep or causes restlessness, it may be beneficial to adjust your cutoff time or consider switching to decaffeinated options. When it comes to alcohol, there are some key points. Effects of alcohol. Alcohol is a drug that can have various effects on the mind and body. It can impair judgment, coordination, and reaction time, and it can also affect mood and behavior. Excessive alcohol consumption can lead to health problems, including liver damage, cardiovascular issues, and an increased risk of certain cancers. Moderate alcohol consumption is generally defined as up to 1 drink per day for women and up to 2 drinks per day for men. It's important to note that these guidelines may vary depending on factors such as age, health condition, and individual tolerance. Risks of excessive drinking. Excessive alcohol consumption, including binge drinking, can have serious health consequences. It can increase the risks of accidents, injuries, liver disease, addiction, and mental health issues. It can also negatively impact relationships, work, and overall well being. Alcohol and cancer. There is evidence linking alcohol consumption to an increased risks of certain cancers, including breast, colorectal, and liver cancer. Even moderate alcohol intake can contribute to these risks. Alcohol and adolescence. It's important to note that the legal drinking age varies by country, but in the United States, it is 21 years old. Adolescents and young adults are particularly vulnerable to the negative effects of alcohol due to their developing brains and increased risk taking behaviors. It's crucial to educate young people about the risks associated with alcohol and provide support if needed. Individual differences. It's important to recognize that individuals may have different reactions to alcohol based on factors such as genetics, body weight, metabolism, and overall health. Some people may be more susceptible to the effects of alcohol than others. What does alcohol do to hydration? Alcohol can have dehydrating effects on the body. Diuretic effect. Alcohol is a diuretic, meaning it increases urine production and can lead to increased fluid loss from the body. It inhibits the release of antidiuretic hormone ADH, which normally helps the kidneys reabsorb water and reduce urine output. Increased urination. Alcohol consumption can result in increased urination, causing the body to lose more water. This can contribute to dehydration. Fluid retention. Alcohol also reduces fluid retention by releasing the hormone of ADH, which can further contribute to dehydration. Hydration tips. To mitigate the dehydrating effects of alcohol, it is required to drink water while consuming alcohol. Having at least 1 glass of water for each serving of alcohol can help hydration. Additionally, drinking water regularly, consuming other hydrating beverages, and eating foods with high water content can also help hydration. Alcohol concentration. The concentration of alcohol in a drink can affect its potential for dehydration. Beverages with higher alcohol content may have a greater dehydrating effect compared to those with lower alcohol content. It's important to note that while alcohol can contribute to dehydration, the effects can vary depending on factors such as the amount of alcohol consumed, individual tolerance, and overall hydration status. It's also a good idea to drink alcohol in moderation and to stay hydrated by consuming water and other hydrating fluids. Can alcohol reduce water absorption in cells? Yes, alcohol consumption can potentially affect water absorption in cells. Dehydration. Alcohol has a diuretic effect, which means it increases urine production and can lead to increased fluid loss from the body. This can contribute to dehydration. The presence of alcohol in the body can interfere with the normal water balance in cells, potentially affecting their ability to absorb water properly. Inhibition of water balance. Alcohol can disrupt the water balance in muscle cells, potentially altering the ability to produce energy. It can also interfere with the production of adenosine triphosphate, ATF, which is essential for muscle contraction and energy production. Effects on metabolism. Alcohol metabolism can lead to the production of acetaldehyde, a toxic substance that can have damaging effects on cells and tissues. Acetaldehyde exposure can occur in various tissues, including the gastrointestinal tract, pancreas, and brain. Interaction with nutrients. Alcohol can interfere with the absorption and utilization of certain nutrients, such as folic acid and zinc, which are important for energy, metabolism, and cell function. It's important to note that the effects of alcohol on water absorption in cells can vary depending on factors such as the amount of alcohol consumed, individual tolerance, and overall hydration status. Additionally, the bottle has mechanisms to maintain water balance, but excessive alcohol consumption can disrupt these processes. To mitigate the dehydrating effects of alcohol, it is recommended to hydrate before, during, and after alcohol consumption. Drinking water before and in between alcohol beverages, pacing yourself, and consuming hydrating foods can help maintain hydration levels. So, in conclusion, remember that you need both food and drink to be well hydrated. Limit alcohol and caffeine to help stay hydrated. I hope that this video has been informative. Please leave a message and tell me if you liked this video. I would also like to apologize for any words that I mispronounced in this video. Sometimes medical words are a little difficult. And oh yeah, don't forget, subscribe,